come in.
Hi, Patty. My name is Ashley. I'm going to be your CNA for today. Is it okay if I provide your care?
Yes.
Okay, let me get my gloves on. All right, Mrs. Smith, we're going to be doing Peri care today. Is that okay? All right, let me gather my supplies. I'm going to put down my barrier on the table. And then I'm going to gather my washcloths. I need 4 washcloths and 2 dry towels. I need a barrier to place under the resident and soap to clean the peri area. Then I also need water. Before I begin, I'm going to raise the bed to a good working height for me. Okay, I'm going to put all of my washcloths into the water. Then I'm going to use my soaker pad and I'm going to place it under my resident. All right, Mrs. Smith, could you please lift your hips for me while I place this pad under you? Okay. And then I'm going to get my first washcloth and wring it out. And I'm going to be sure that I have it folded into 4. Because I'm going to put soap on these 4 corners. I'm going to get this washcloth soapy. Now, as I do each wipe, I'm only going to use one corner for one way. I'm going to lift up her gown, and I'm only going to expose the area that I'm going to be cleaning. Okay, so now that I have the 4 sides, I'm going to fold the washcloth, use one side and go down. I'm going to change the side of the washcloth, go down the other side. I'm going to change the side of the washcloth, go down the middle. I'm going to change the side of the washcloth. Tell the resident I'm separating the labia, the inside, and then cleanse down. And I throw that away. I'm then going to get my rinse washcloth, and I'm going to use the same 4-corner method. So I'm going to do down one side, change the side of my washcloth, down the other side, change the side of my washcloth, go down the middle, change the side of my washcloth, and then I'm going to tell her that I'm separating the labia going down the middle. Then I'm going to discard that used washcloth. Then I'm going to pat her dry. And I'm going to discard that towel. I'm then going to provide her privacy. I'm going to get my next washcloth ready because I'm going to turn the resident towards me. During testing, it does say that you can turn the resident away from you, but if you choose to do that, you need to have the test proctor come and stand on that side because you should never, ever, ever turn a resident away from you without somebody being there. So I'm going to soap up my corners again, my 4 corners, and then I'm going to make it soapy. I'm actually going to place this onto my barrier. And then I'm going to have the resident turn towards me. I have her cross her arms, and I'm going to use her hip and her shoulder to turn her towards me. I'm going to take my four-corner method, the same method, use one corner. Now this time we're going to go away from her vaginal area, making sure that we're cleaning it from front to back. So I'm doing one side, up the side, and then I'm changing the side of my washcloth. Then I'm going to do the other side, go away from the vagina, and then I'm changing the washcloth. I'm going up the middle, changing the side of my washcloth, and then just one more up the middle to be sure that she is clean. And I'm throwing that into the dirty linen. Now you see I'm never leaving the side of my resident because we don't want her to roll out of the bed. So I'm going to use my rinse washcloth, and I'm making sure that I use my four-corner method again. So I'm going to go up one butt cheek, then change. Then I'm going up the other butt cheek, and then I'm going up the middle, away from the vagina always. And then one more for good measure. And I'm throwing this into the dirty linen. And then I'm going to dry the buttocks. I'm actually going to roll the barrier that I placed underneath of her in the beginning towards me so that when I roll her back onto her back, I can remove the barrier. And I would throw that into the garbage. I am then going to remove my gloves, throwing those away, sanitizing my hands. I'm going to replace her sheet. I'm going to lower the bed for safety and give her her call light. Ask her if she needs anything else before I clean up her area. Put this into dirty linen. Go and empty, rinse, and dry my bucket. Open the curtain. Sanitize my hands. And task complete.